Welcome to c-meditech Online Academy. Today we are going to discuss the recent questions from Haad Pharmacy Technician Examination. So first question is, a 68-year-old man has been diagnosed with benign prostatic hyperplasia. Which of the following drug is most appropriate to improve urinary flow? A. Tamsulosin, B. Atropine, C. Pilocarpine, D. Neostigmine. So benign prostatic hyperplasia. It is a condition in which the prostate gland enlargement occurs due to which urinary retention occurs. Okay, the patient feel very painful to pass the urine due to this enlargement. So which of the following drug is most appropriate to improve urinary flow? That is a question. So here, tamsulosin. Tamsulosin is a alpha adrenergic blocker which act by relaxing the smooth muscles of prostate, along with they also that means relaxes the bladder neck, thereby helping improving the urinary flow. Okay. Then in this case of atropine, atropine usually worsen the condition of this benign prostatic hyperplasia by causing this urinary retention. So atropine cannot be given in this case of condition. Then C and D, that is the pilocarpine and neostigmine, both cannot be given for conditions of benign prostatic hyperplasia. Is not a drug of choice for benign prostatic hyperplasia. So that here the drug of choice that can be given for the treatment of benign prostatic hyperplasia is tamsulosin. So the answer is option A, tamsulosin. Then next question, question number 2. A 60-year-old woman is diagnosed with mixed edema. Which drug should be initiated for long-term treatment? A. Methimazole, B. Levothyroxine, C. Propranolol, D. Prednisolone. Then what is mixed edema? Mixed edema is a condition in which there is a severe hypothyroidism occurs. Okay, not hyper, it is hypothyroidism. So which drug should be initiated for long-term treatment of mixed edema? Since there is a severe type of hypothyroidism occurs, here the drug that can be given for treatment of this mixed edema is levothyroxine, which usually displaces this deficient thyroid hormone. So the drug which can be given here is levothyroxine. Then what about methimazole? Methimazole is mainly used for the treatment of hyperthyroidism condition. Okay, like in the case of Graves' disease and all that, we can give this methimazole. But in this case of mixed edema, it is severe hypothyroidism. So here the drug that can be given is levothyroxine. Question number 3. A 24-year-old woman with a history of atopic dermatitis present for routine follow-up. She reported recurrent flare-up characterized by dry, itchy skin, especially during seasonal changes. The physician decided to prescribe a topical medication to reduce inflammation and itching during acute episodes. Which of the following medication is most appropriate initial treatment? A. Hydrocortisone cream, B. Acyclovir cream, C. Permethrin cream, and D. Mupirocin ointment. So here a 24-year-old woman with a history of atopic dermatitis. So that and also there is a she has recurrent flare-ups characterized by dry, itchy skin, which occurs especially during seasonal changes. So the drug which can be used to reduce inflammation and itching, especially in case of acute dermatitis, is we can prefer hydrocortisone cream. Okay, so what is this atopic dermatitis? Atopic dermatitis is actually a chronic skin inflammatory disease, and in this case we can give this topical corticosteroids like this hydrocortisone cream. Then what about this acyclovir? Acyclovir is actually an antiviral medication which is mainly given for herpes infestations. Next about permethrin. Permethrin is mainly used for treatment of scabies infestations. And what about this mupirocin? Mupirocin is actually an antibiotic which is used for bacterial skin infection. Okay. So here the drug that can be given for this atopic dermatitis, which is a chronic skin inflammatory condition, here the drug that can be given is hydrocortisone cream because it is a topical corticosteroid, and we know that corticosteroids usually have powerful anti-inflammatory property. Then question number 4. A 32-year-old woman with myasthenia gravis report increasing muscle weakness towards the end of the day. The neurologist prescribed a medication that increases acetylcholine availability at the neuromuscular junction. Which drug is most appropriate? A. Pyridostigmine, B. Atropine, C. Benztropine, D. Propranolol. Okay, then what about the myasthenia gravis? Myasthenia gravis means it is an autoimmune condition in which the antibodies are produced against acetylcholine receptors. Okay, that medical condition is called as myasthenia gravis. So in this condition, we have to enhance the level of acetylcholine in our body. So the drug that can be given for treatment of myasthenia gravis is pyridostigmine. So what the pyridostigmine do? Pyridostigmine will inhibit acetylcholine esterase. Thereby, acetylcholine esterase means it is an enzyme that destroys the acetylcholine. So here the pyridostigmine will inhibit this acetylcholine esterase, thereby enhances the level of acetylcholine in the body. Okay, or the acetylcholine availability at the neuromuscular junction. So here the drug that can be given is pyridostigmine. Then atropine, which is a muscarinic receptor antagonist. Then benztropine, which is used for the treatment of Parkinson's disease. Then what about propranolol? Propranolol is a beta blocker. So these atropine, benztropine, propranolol, these are not given for treatment of myasthenia gravis. The drug which can be given for the treatment of myasthenia gravis is pyridostigmine. But for the diagnostic purposes, we can use edrophonium. Okay. Then question number 5. A 42-year-old man with chronic plaque psoriasis has thick scaly lesions on both elbows and knees. The dermatologist decided to prescribe a medication that slows excessive epidermal cell proliferation without causing significant systemic adverse effect. Which drug is most appropriate? A. Calcipotriol, B. Terbinafine, C. Cetirizine, and D. Acyclovir. Okay, so chronic plaque psoriasis. Chronic plaque psoriasis means it is a skin condition in which excessive, that means skin cells or keratinocytes will be formed, due to which what happened is that a thick scaly plaques will be formed in our body. Okay, so chronic plaque psoriasis, it is a skin condition in which excessive level of keratinocyte or skin cells will be formed, due to which a rapid turnover, what happened, thick scaly plaques will be formed in our body. So the drug that can be given for this treatment is calcipotriol. Calcipotriol is actually the vitamin D analog, which what this calcipotriol do is this, it inhibits the rapid turnover of this epidermal cells, and also it normalizes the skin cell growth and differentiation. Okay, then what is about terbinafine? Terbinafine is an antifungal medication. Then cetirizine, we know cetirizine is an antihistaminic drug, and acyclovir, which is an antiviral medication mainly used for treatment of herpes infestation. So in case of this plaque, in case of this psoriasis condition, that is chronic plaque psoriasis, we can give this calcipotriol, which is a vitamin D analog. Okay. Then question number 6. A 67-year-old man with primary open-angle glaucoma requires medication to reduce intraocular pressure and prevent optic nerve damage. The ophthalmologist prescribed a topical beta blocker. Which medication was most likely prescribed? A. Timolol, B. Atropine, C. Diphenhydramine, and D. Pilocarpine. Okay, a 67-year-old man with primary open-angle glaucoma requires medication to reduce intraocular pressure. So we know that in the case of open-angle glaucoma, usually the intraocular pressure rises due to excessive aqueous humor formation. So what we have to select here is clearly given that ophthalmologist prescribes a topical beta blocker. So in this case, timolol is a topical beta blocker. It can reduce the intraocular pressure by reducing the formation of aqueous humor. So the drug that can be given in this case, a primary open angle glaucoma, which is a topical beta blocker, is timolol. Then what about atropine? Atropine will worsen the condition of open angle glaucoma. Then diphenhydramine and pilocarpine. Pilocarpine orally is, it's not, you cannot choose pilocarpine oral here because it's clearly given that the ophthalmologist prescribes a topical beta blocker. So here the drug that can be given in this case of primary open angle glaucoma is option E, that is timolol. Question number 7. A patient is diagnosed with H. pylori associated peptic ulcer disease. The physician wants to eradicate the infection completely. Which treatment regimen is most appropriate? A. Omeprazole plus amoxicillin plus clarithromycin. B. Paracetamol plus aspirin. C. Digoxin plus furosemide, and D. Diazepam plus carbamazepine. So we know that H. pylori associated peptic ulcer, we usually prefer triple drug regimen. Triple drug regimen usually include one, this proton pump inhibitor along with these 2 antibiotics. Okay, so in this case, one of the proton pump inhibitor is omeprazole, and the 2 antibiotics that can be given is amoxicillin along with this clarithromycin. And here in this case of H. pylori infection, we can also prefer quadruple therapy. Okay, this quadruple therapy means which usually contain 4 drugs. And this quadruple therapy is usually preferred when there is a patient is having resistance against clarithromycin. So quadruple therapy usually include bismuth will be there along with one proton pump inhibitor, which can be omeprazole or pantoprazole, something like that. Then one proton pump inhibitor will be there along with, you can give tetracycline, then plus metronidazole. So this is the quadruple therapy, metronidazole. So the quadruple therapy usually given for this H. pylori associated peptic ulcer if the patient is having resistance against clarithromycin. So in this case, since the patient is diagnosed with H. pylori associated peptic ulcer, the treatment regimen we can prefer is option A, that is omeprazole plus amoxicillin plus clarithromycin. Question number 8. A patient with Graves' disease has recently been diagnosed with hyperthyroidism. The endocrinologist decided to prescribe medication that inhibit thyroid hormone synthesis. Which medication is most appropriate? A. Methimazole, B. Levothyroxine, C. Insulin, D. Hydrocortisone. So Graves' disease. What is Graves' disease? Graves' disease is an autoimmune condition in which our immune system produce thyroid stimulating immunoglobulins. What happens when thyroid stimulating immunoglobulins will be produced in our body? This will accidentally activate the thyroid gland, which may lead to excessive production of T3 and T4. Okay, the condition is called as Graves' disease. So Graves' disease means it is an autoimmune condition in which our immune system produce thyroid stimulating immunoglobulins, which will accidentally stimulate thyroid gland. That will lead to excessive production of T3 and T4. That means actually it is a condition in which hyperthyroidism occurs in our body. So, which type of medication is most appropriate for this condition? A. Methimazole, B. Levothyroxine, C. Insulin, D. Hydrocortisone. So, in this condition of Graves' disease, we can give methimazole. Methimazole actually it blocks this thyroid hormone production, thereby inhibit the synthesis of thyroid hormones like T3 and T4. And levothyroxine is used for hypothyroidism state, and insulin we know it is used for treatment of diabetes. And hydrocortisone, which is used for the treatment, it's cortisol. It's used to actually act as a replacement therapy for cortisol. So in this case, the answer will be methimazole. Question number 9. A 29-year-old woman with a systemic lupus erythematosus is being started on long-term medication to decrease disease activity and reduce flare frequency. Which medication is commonly prescribed? A. Hydroxychloroquine, B. Furosemide, C. Levodopa, D. Acyclovir. Okay, so a 29-year-old woman with systemic lupus erythematosus. So SLE or systemic lupus erythematosus, this is also an autoimmune condition in which our own immunity will destroy the healthy tissues and organs present in our body. Okay, so which medication is commonly prescribed for this condition? Options include hydroxychloroquine, furosemide, levodopa, and acyclovir. So in the condition of systemic lupus erythematosus, the cornerstone therapy for this SLE is hydroxychloroquine. And what this hydroxychloroquine do is it will reduce the disease activity and also it will helpful in preventing the flare situations. Okay. And furosemide, we know it is actually a diuretic, and levodopa, it is mainly used for treatment of Parkinson's disease. And acyclovir is an antiviral medication. And question number 10. A 68-year-old postmenopausal woman with osteoporosis has sustained a low-impact vertebral fracture. The physician wants to prescribe a medication that inhibits bone resorption. Which medication is most appropriate? A. Alendronate, B. Prednisolone, D. C-methotrexate, and D. Digoxin. So osteoporosis, we know osteoporosis is a condition in which the bone destruction occurs in our body. So here we have to give a medication that will decrease the activity of osteoclast. So what is osteoclast? Osteoclast means it is a bone destructing cells is called osteoclast. Okay. So here we know the drug which can be used for treatment of osteoporosis is bisphosphonate. So the different bisphosphonate include this alendronate, pamidronate, etc. Okay. So in this case, alendronate can be given and it inhibits osteoclast activity. Or osteoclast means these are bone destructing cells. So by destructing this osteoclast, thereby they are helpful in the treatment of osteoporosis. Then prednisolone, it may worsen the condition of osteoporosis by increasing the level of osteoclast in the body. Then methotrexate is an autoimmune used for treatment of autoimmune diseases like this rheumatoid arthritis and all that. Then digoxin, mainly it is used as an cardiac medication. Question number 11. A 3-year-old boy is prescribed 130 mg of amoxicillin. The available suspension contains 250 mg in 5 ml. How many milliliters should be administered? So in this case, we know that the boy is prescribed 130 mg and here the 250 mg is present in 5 ml. So we have to find out 130 mg is present in how much ml. Okay, so here this is very simple, that is 250 mg is present in 5 ml. So 130 mg is present in x ml. So in order to find the value of x is equal to just cross multiply these values. 130 into 5 divided by 250, you will get the answer as 2.6 ml. Okay, so very simple question. Next question is, a pharmacist must prepare an extemporaneous moxifloxacin oral suspension with a concentration of 20 mg per ml and a total volume of 60 ml. Available tablet contain 400 mg moxifloxacin each. How many tablets are required? Option A, 2, 3, 4, 6. Okay. So here you can see that a pharmacist must prepare an extemporaneous moxifloxacin oral suspension with a concentration of 20 mg per ml with a total volume of 60 ml. So here 20 mg is present in 1 ml. So first of all, we have to find out 60 mg is present in how much ml. So 20 is present in 1 ml. So 60 ml contain how much mg? 60 ml contain x mg. Okay. So x is equal to 60 into 2, that is equal to total of 1200 mg. So in order to get 1200 mg, how much or how many tablet of 400 mg should be need to be dispensed? That means 1200. So 400. How many tablets we need to dispense in order to get 1200 mg? 3 tablets, isn't it? That means 400 into 3, 1200. So we need to dispense 3 tablets in order to get 1200 mg, because this 60 ml contain total of 1200 mg. So the answer is B. That is answer is 3. Option B, 3. Question number 13. An estradiol pump is prescribed at a dose of 1.5 mg per day for 160 days. Each pump activation delivers 0.75 mg estradiol. One pump pack contains 80 gram and each activation dispenses 1.25 gram. How many pump packs are needed? Option A 3, B 4, C 5 and D 6. So this calculation contains multiple steps. First of all, you have to know here an estradiol pump is prescribed at a dose of 1.5 mg per day for 160 days. So first of all, you have to calculate how much milligram of drug need to be dispensed for this 160 days. First of all, we can do that calculation. So here we know 1.5 mg is required per day. Okay, and each activation 0.75 mg is delivered. So how many activations are required per day? 1.5 mg per day is required. That's a total dose, and for in one activation 0.75 mg is delivered. So in order to get 1.75 mg, 2 activations are needed per day. Okay, that is the first step. Then second step, what is the total activation required for 160 days? 160 into 2, that is equal to 320 activations are needed for total of 160 days. So first you find out how much activations are required for 1 day. Since you required 1.5 mg per day and 0.75 mg is delivered per activation, total of 2 activations are needed in order to deliver 1.5 mg. Then for 160 days, it is total of 320 activations are required. In step 3, you have to determine the activations per pack. We know 80 mg. A pack contains 80 mg and each activation uses 1.25 gram. That means one pack provides actual of 64 activation. One pack provides 64 activation, and how much pack we are procuring? Okay, so we need in total of 160 days, we need total of 320 activation, and here 320 divided by 64, that means actually how much pack we are requiring here? 5 pack. Okay, so we need to find out the total pack required in this equation. So the answer will be 5 packs. Question number 14. A 28-year-old woman present to the clinic with symptoms of an uncomplicated urinary tract infection. The physician prescribes a combination antibiotic containing sulfamethoxazole and trimethoprim. Which of the following brand name correspond to this combination? Option sulfadiazine, augmentin, flagyl, Bactrim. Okay, so here sulfamethoxazole trimethoprim combination, and the combination name is cotrimazole. And what is the brand name? The brand name is Bactrim. Okay, sulfamethoxazole trimethoprim combination, and that is the brand name is Bactrim. So the answer is option D, that is Bactrim. Question number 15. A 55-year-old man with type 2 diabetes mellitus has inadequate glycemic control despite lifestyle modification. His physician instead Januvia therapy. So Januvia is actually the content present in Januvia is sitagliptin, and Januvia belong to which pharmacological class? A. Thiouracil derivative, B. Guaiguanate, C. Sulfonylureas, D. Dipeptidyl peptidase 4 inhibitors. So sitagliptin belong to which category? Belong to DPP4 inhibitor, DPP4 inhibitors, dipeptidyl peptidase 4 inhibitors. By inhibiting this DPP4 enzyme, which normally break down the incretin hormone, thereby what happens in our body? It may result in enhanced insulin secretion, it reduces the glucagon release, and thereby help in good glycemic control. Question number 16. A 30-year-old pregnant woman is diagnosed with chronic hepatitis C infection. The healthcare provider is reviewing medication that must be avoided during pregnancy because of severe teratogenic risk. Which of the following drug is absolutely contraindicated during pregnancy? A. Ribavirin, ranitidine, rifampin, unfractioned heparin. What is the answer? That is a drug which is completely contraindicated during pregnancy. The answer is Ribavirin. Option A is the answer. Ribavirin is highly teratogenic and is also embryotoxic. When it is used in pregnancy, it can cause severe fetal malformations and even may lead to pregnancy loss, and also it may cause abnormality abnormalities in the developed fetus. So it should be completely avoided in the pregnancy. So category X drug should be completely avoided in pregnancy. Okay. So this is all about today's question discussion. Thank you. For GCC exam related coaching and for data flow related queries, please do contact c-meditech Online Academy.